Hello, namaste. My name is Dr. NEISHA BHATTACHARYA. I am the first registered chiropractor in Kathmandu, Nepal. I did my schooling in the US in Portland, Oregon. I have been practicing for 4 years. So chiropractic care is essentially the care of the musculoskeletal system. So that is of your skeleton and the muscles, ligaments, and joints connected to it. So any joint in your body is what I take care of. We believe that the muscles and joints are all related together, and that if we take care of both of them, we can get rid of neck pain, back pain, and any other joint pain in your arms and your legs. Chiropractic care definitely does work, and it is safe. It is clinically proven to help with neck pain, back pain, headaches, and joint pain. It is a drug-free, non-invasive treatment. But like any other medical treatment, there are some risks that are associated with it, but they're very minor, so it's considered to be a very safe treatment. So for our first visit, it's traditionally the longest visit of all our visits, because we have to go through a detailed history to get an idea of any issues that have happened in the past. Then we do a very thorough physical exam to kind of get a very good picture as to what is going on currently. Then we go through all your images and reports that you might have had, CT scans, MRIs, X-rays, all of those reports we go through, and then we come to a diagnosis as to what is going on. And based on that diagnosis, we make a treatment plan, and that will determine how long your treatments will go on for, how many visits you need, and how long it will take before you can get better. I want to discuss about the chiropractic adjustment or manipulation and how that can kind of affect the rest of the body. So if we look at this spine here, and this gives you a better idea, visual idea, as to how the nerves and the spine work itself. So if you can see in here, these are the spinal nerves that go out and come into your hands or go down into your leg, kind of connect to your entire body. So as you can see, there's a little hole here where the nerves come out of. So what can happen when you have pain or problems in the spine, that you have a little bit of an overlap like this. So as you can see, this part of the spine is pushing down on the nerves, and that's where you get the pain that comes into different parts of the body. So as you can see, when we kind of have dysfunction or problems in the spine, it causes pressure on the nerves like this, and the spine, as you can see, is not in the place that it's supposed to be. In a natural state, this is not how our spine is supposed to function. So as chiropractors, what we do is we get the spine to come back into place where your natural, normal state of your spine is supposed to be. And then there's not any pressure left on these nerves, which reduces the pain that you're feeling in your body as well. So if you are experiencing any kind of neck pain, back pain, pain in your joints, or if you frequently get headaches or migraines, and you want to find a different way to treat these issues, I would be the best person to come and do a consult with. I'm at Norvik International Hospital. I am currently the only registered chiropractor in the country. This is a great opportunity for you to come and see something different and see an option where you don't have to take pain medications if you don't desire to. This is a great opportunity to try something different and relieve your pains that you've been dealing with for years potentially.